Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the affirmation platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
God our Father, we come to you in our need to ask your protection against the COVID 19 virus that has claimed lives and has affected many. We pray for your grace for the people tasked with studying the nature and cause of this virus and its disease, and of stemming the tide of its transmission. Guide the hands and minds of medical experts that they may minister to the sick with competence and compassion, and of those governments and private agencies that must find cure and solution to this pandemic. We pray for those afflicted. May they be restored to health soon. Grant us the grace to work for the good of all and to help those in need. Grant this through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God, forever and ever. Amen. Mary, help of all Christians, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calungsod, pray for us.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM live stream.
The title of this forum is What Women Should Know About Advanced Cervical Cancer. Ang mga dapat malaman ng mga kababaihan ukol sa advanced cervical cancer. Today's forum aims to tackle concerns on treatment, survivorship, and end-of-life concerns relating to advanced cervical cancer. For today's forum, we have Dr. Gladdy Maura Facun, one of the authors of OB-GYN Pearls, a diplomate of Philippine Obstetrical and Gynecological Society, and a subspecialist of gynecologic oncologist as our moderator. Thank you for attending the
Good morning, everyone. Welcome again to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, the Mu Sigma Phi Medical Foundation, UP College of Medicine, Philippine General Hospital, and the City of Manila. This forum is a series of panel discussion that aims to discuss common concerns of women from all walks of life. Today, we are on the fifth leg of the series, which focuses on advanced cervical cancer. Ang mga dapat malaman ng kababaihan ukol sa advanced cervical cancer. For any questions for our speakers later, you may type them in the Q&A boxes of UP Manila live stream and Zoom, or the chat boxes of FB Live and YouTube. Our fifth webinar, entitled What Women Should Know About Advanced Cervical Cancer, ang mga dapat malaman ng kababaihan ukol sa advanced cervical cancer, aims to discuss the general course of advanced stage cervical cancer as well as the treatment options available in the Philippines. This forum also aims to tackle issues on survivorship and the possible outcomes for women experiencing this disease. So to formally start the webinar, I am honored to introduce our speakers. Here with us today are both alumni of the College of Medicine and are distinguished professors and clinicians in the field of gynecologic oncology. They've both held key positions in their societies, forwarding the welfare of cancer patients. For our first speaker, she is a graduate of the UP College of Medicine class of 2000 and also a member of the Mu Sigma Phi sorority batch 2000. Dr. Castro is a clinical associate professor in the Division of Gynecologic Oncology in the Philippine General Hospital. Moreover, she is the coordinator for the training of residents and fellows in the same institution. So she is currently the vice president of the Philippine Society for Cervical Pathology and Colposcopy. Aside from being an academician, Dr. Castro is also a consultant in PGH, Manila Medical Center, and KPI in Manila Doctors Hospital. Everyone, let's welcome Dr. Carolyn or Zalameda-Castro.
Hi, Gladdy. Thank you for that introduction. Let me just share my slides. There, do you see it?
Yes,
Okay,
ma'am.
thank you so much. Magandang hapon po sa inyong lahat. Thank you for tuning in and spending your lunchtime with us. Cervical cancer is a common topic among webinars, but rarely do we focus or zoom in on the topic of advanced cervical discussion of advanced cervical cancer. So allow me to engage you to a lively exchange of question and answer later on by discussing with you some of the key points of advanced cervical cancer. But before that, let's just have a little review of what the cervix is. Where exactly is it? No, nasaan ba ang cervix? No? So cervix is part of the female reproductive system, and the female reproductive system is found in the pelvic area of women, no? Sa puson, sa area ng puson. And if we magnify the view of this reproductive system, we see that the cervix is the lower part of the uterus or the womb, where the baby grows when a woman is pregnant. And any malignant growth that involves the cervix is called cervical cancer. It comes in various stages. It has various stages depending on the size of the lesion, the extent of the tumor in surrounding structures, as well as in distant organs, and the organs that are involved by the tumor. So I think for us to appreciate the discussion on cervical cancer, we have to understand the burden of disease that cervical cancer causes. Worldwide, it is the fourth most common cancer in women. You look at our figures here. These are the incidences and mortality rates. You see they are in the hundreds of thousands annually worldwide, and even the death is in the hundreds of thousands. A more unfortunate information is that these numbers, they're not divided equally among the countries. More than 85% of these cases of cervical cancer occur in low and middle income countries. No? So 85% nasa low and middle income countries. So hindi siya parang i-divide mo lang to among the countries in the world. It's not like that. What about locally? In the Philippines, cervical cancer is the second most frequent cancer in Filipinas. It is also the second most common cancer-related deaths among Filipino women. You look at our statistics, annually we have about 7,897 new cases and 4,052 cases of deaths every year. If we make simple mathematical calculations, this is actually translated to one Filipina dying every 2 hours from cervical cancer. Why is that? Bakit? Ganun ba ka-aggressive ang cervical cancer? Is it because cervical cancer is such a fatal type of cancer? Is it highly aggressive? Actually, it is not. It is highly preventable and highly curable, especially if we catch it at an early stage. The problem is 2/3 of the Filipino women come in for consult late in the course of the disease, and most of the time, the diagnosis is achieved at the advanced cervical cancer stage already. So when we say advanced cervical cancer, what do we really mean? If you go through literatures, there are varying definitions to it. You would see this term, locally advanced cervical cancer, to mean that the cervical mass has grown big beyond 4 cms and has spread around the adjacent structures, yung mga karatig na struktura ng cervix. In front of the cervix is the bladder, behind it is the rectum. So involvement of those organs would constitute what we call a locally advanced cervical cancer. Advanced cervical cancer may also mean metastatic, meaning it has spread beyond the pelvis to involve the organs in the abdomen. For example, the bones, the liver, the abdomen, the brain even, the lymph nodes, So if it has spread beyond the pelvic area, then we call it metastatic cervical cancer, and it also falls under advanced cervical cancer. It can also mean recurrent, meaning cervical cancer that has been treated in the past and has come back or has recurred. This also falls under advanced cervical cancer. Okay, what is the experience in our hospital? You take a look at this graph. This is the number of cervical cancer cases, the new ones, no, from 2016 to 2020. We see that the numbers are fairly constant. This is in 2020. It does not mean that there was a decrease in the incidence. It just means that the numbers or our consults were affected by the pandemic. So, but if we look at all of them, you see the blue part of the graph constitutes the advanced stage cervical cancer, and the orange are the ones that are early stage. So if you will look at this graph, it tells us that more than 80% of new cases of cervical cancer come in already in the advanced stage. So how does cervical cancer spread, or where does cervical cancer spread? First, it will spread in the adjacent structures. As I mentioned earlier, cervix is located in the pelvis. And in other pelvic structures include the bladder, yung pantog po, no, tsaka yung bituka, yung rectum. So naturally, we expect that cervix will spread to its adjacent structures, sa mga katabi niya. It may also spread in distant organs, in the abdomen, in the lungs, in the bones, and in the lymphatic system, or in the lymph nodes, by several processes. Sa pelvis, by direct extension, no? Kumakalat siya sa mga katabi niya, direct spread. It can also be by hematogenous spread, or from the blood supply. No? Tumors can get into the blood system, and pag-ikot ng dugo can be deposited in other parts of the body, and these tumor cells that are lodged in other parts of the body may eventually grow into obvious masses, and this will constitute metastasis. It may also spread by lymphatic permeation to involve the lymph nodes. Okay. Now, what are the symptoms of advanced cervical cancer? This picture is taken from a page in Kwento ni Anita. Kwento ni Anita is a lay info comics on cervical cancer. And this picture practically summarizes the symptoms of advanced cervical cancer. No? It usually, patients would usually present with foul-smelling vaginal discharge, bleeding, all sorts of pain on intercourse, masakit ang puson, masakit ang balakang, masakit ang buto, urinary and bowel changes, no? May dugo sa pag-ihi, hindi makapagpigil ng ihi, hindi makapagpigil ng pagdumi, may dugo sa dumi, pamamaga ng legs, no? Edema, extreme tiredness, parang hindi naman masyadong kumilos pero pagod na pagod, weight loss, despite adequate food intake, nangangayayat. And there are other symptoms that the patient can present with depending on the organs that are involved by the tumor. Now, how do we diagnose advanced cervical cancer? The ideal will be a whole body PET CT scan. This is the preferred method. Mode of diagnosis or preferred imaging. However, this is not always available in all institutions, and this is quite costly. So an alternative would be a CT scan with contrast, focusing on the abdominal, pelvic, and chest regions. We can also utilize an MRI of the pelvis to assess local disease extent, no, yung kalat in adjacent structures. But if these modalities are still not affordable or not available, we can always make use of ultrasound, abdominal and pelvic ultrasound, and other imaging modalities which we think would be fit for us to come up with, for us to be able to investigate probability of recurrence or metastasis based on the symptoms that the patient would present with. Okay, now treatment. How do we treat advanced cervical cancer? It cannot be decahon. When we talk about advanced cervical cancer, it always has to be on a case-by-case basis. And these are the things that we have to think about. Where has the cervical cancer spread? Gaano na siya ka-extensive? Saan siya kumapit? What treatment has been given before? Kung meron na pong treatment dati, that is very important because that will guide us to what available treatment modalities we can offer. We have to look at the general health and fitness of the patient. We know that these treatments are not without risks. They're not very easy. So kapag hindi masyadong maganda ang pangangatawan ng isang babae, baka hindi niya matolerate yung effects of the treatments. We have to look at the general health and fitness of a patient. And of course, the patient's preferences. We have to have a good discussion of all the available options with the patient. And we have to respect her preferences. Now, we always encourage multidisciplinary team approach. It cannot be just us. Hindi pwedeng gyne-onco lang in the management of advanced cervical cancer. It will be best for the patient if several heads think for her, if several doctors help each other in the treatment of a patient. Of course, palliative care is also an essential element of cancer management to relieve unnecessary pain and suffering due to the disease, and Dr. Toral will detail this more later on. Now, what are the components, or what are in the armamentarium when we treat cervical cancer? There are systemic treatment options and there are local treatment options. Most of the time, if advanced, we will have to resort to systemic treatment so that we can address all of the foci of metastasis. So usually chemotherapy. Pag sinabi po natin chemotherapy, ito po yung gamot sa cancer. No? Sometimes kasi patients will tell you, gamot na lang po, wag na chemo. When we say gamot para sa cancer, it's actually chemotherapy. It's a collective term for several medications that would attack the tumor directly wherever they are in the body, because this is given either by suero, no, sa suero, or orally, and it can attack tumor in many parts of the body at the same time. We can also have targeted cancer therapy. One example is bevacizumab. How to explain this to patient? I always say that chemotherapy attacks the tumors directly. Pero yung nagsusupply ng nutrition, yung nagpapataba, nagpapalaki sa tumor, meron din, or the blood supply, meron din nag-a-attack doon. And this is the targeted cancer therapy. Then there is also, of course, immunotherapy, and pembrolizumab is the recommended immunotherapy for cervical cancer. It allows the immune system to target and destroy cancer cells without attacking the body itself. So parang tinetrain yung immune system to recognize those cancer cells and attack them. Of course, there is also the local treatment. However, when we talk about advanced cervical cancer, it may not always be applicable. No? So, but the local treatment, we can have radiotherapy if there are areas in the body that are focal or regional that you can direct the radiation on. For example, locally advanced cervical cancer, kung nasa pelvis lang, kahit na medyo extensive, pero nandun lang sa area na yun, radiotherapy can be instituted with or without chemotherapy. Surgery may not always be applicable for advanced cervical cancer. This is usually limited to early stage. However, there is a concept of pelvic exenteration if radiotherapy has already been instituted and other forms of treatment have been instituted, and if a patient is a good candidate for surgery, this can be discussed. Radical hysterectomy can be done to remove a recurrence or pagbalik sa kwelyo ng matres that has just started. So napakaliit pa lang, kaya pang tanggalin surgically. But most of the time, when we talk about surgery for advanced cervical cancer, it is for urologic or bowel diversion, meaning para matanggal ang pagkakabara sa daanan ng ihi at daanan ng dumi. All right. So as I mentioned, if the cancer is amenable to local treatment, that's what we have to give. But if not, then we have to resort to systemic therapy. Of course, best supportive care, which will be detailed by Ma'am Jean after my talk. Prognosis. A lot of my patients ask me, Doktora, gaano pa ako katagal mabubuhay? Ilang buwan pa po? That particular question is really very difficult for me to answer. Answer is never dekahon. We always have to look at each individual. This is unique to each individual. It depends on how far the cancer has spread, depends on what treatment a patient can have, and depends on what the patient would want to have. So that's it for now, and I'll be happy to entertain your questions later on. Gladdy, thank you.
Thank you very much, Doktora Castro. So, ang dami kong natutunan. Basically, sa lecture ni Doktora Castro, nakakatakot yung sinabi niya na ang cervical cancer ay second most common cancer among Filipino women. And imagine, isang babayang namamatay every 2 hours because of cervical cancer. Pero, no, ang good things doon sa sinabi niya is if it's early stage, it can be cured. No? However, based on sa PGH experience, most are already in advanced stages. So, isang take-home point din natin mula kay Doktora. Ang gamutan sa cervical cancer ay on a case-to-case basis. So, kailangan magpatingin talaga sa oncologist para malaman kung ano yung naampat na gamutan para sa isang pasyenteng may cervical cancer. So, dami ko nang naiisip na tanong. For our audience who have questions, no, you may leave your questions at the Q&A box in our UP Manila live stream or sa chat box ng Facebook or YouTube. So, to further elucidate on the issue of survivorship and end-of-life concerns on cervical cancer patients, let's welcome our next speaker. She is a member of the UP College of Medicine, class 1994. She is also a professor in the Division of Gynecologic Oncology of the Philippine General Hospital. In the same institution, Dr. Toral is also the coordinator for research and medical specialist. So she is the past president of Asia Oceania Research Organization on Genital Infections and Neoplasia Philippines, and currently the treasurer of the Society of Gynecologic Oncologists of the Philippines. Without further ado, let's call on Dr. Jean Ann Toral of Mu Sigma Phi Sorority Batch 1990.
Thank you very much, Gladdy. Yun yung pinakagusto kong lahat sa introduction na sinabi mo. Mu Sigma Phi Sorority ba? 1994. Proud to be Mu. Let me just share my screen. Okay, so can you see it? Okay.
Yes.
So, good afternoon everyone. Magandang tanghali po sa inyong lahat. Salamat sa pagsama sa amin ngayong tanghali. And thank you, Kaka, for laying down the pathway with regard to diagnosis and treatment of patients with cervical cancer. So, indeed, no, the pathway to the diagnosis and treatment is a complex one for many patients, and many patients would probably not understand what is actually going on. No? They don't have a clear grasp of what's happening. They have so many doctors. They have to go to the lab. They have to go to their radiation facilities, sa diagnostics, sa chemotherapy. And really, it's the job of the task of the doctor to lay down that pathway, not only for the patient, but for her loved ones and her caregivers. So this is part 2 of our webinar. And let me introduce the 2 objectives I have for this lecture with these 2 quotes. Now, the first one is from Fighting Cancer quotes. No? It said, surviving cancer is not the end of a gruesome story. It's the beginning of a beautiful one. I would like to answer that part, no, yung survivorship issues. When a woman survives advanced cervical cancer, what is the next for her? No? So that's the beginning of hopefully a beautiful one. And the second quote is from Anne Richardson. Anne Richardson is actually a British writer. She loves to tell stories of people. She has a book about people living with AIDS. She has a book about being a grandmother because she's a grandmother of 3. And this quote actually came from the book she wrote about what it is like to be part of end-of-life care. No? So we cannot change the outcome, but we can affect the journey. So that's the second part, dealing with the end of life. So when a woman progresses in her advanced cervical cancer, how do we deal with the end of life? Okay, so we go first for the first part, the one with the pink quote. No, it's usually more kasi for breast cancer, but cervical cancer is more associated with the teal color. Okay, so this one I got from the Optimal Care Pathway for Women with Cervical Cancer as endorsed by the Australian government. So what is it to for a patient after having her treatment, as mentioned by Kaka? So there are 3 things actually. The first one is the provision of treatment summary. So this actually will also serve as reminders to the doctors here, who take care of cancer patients or cervical cancer, all cervical cancer. So the first one is provision of the treatment summary. So we list for them the diagnostic test performed, the tumor characteristics, the type and date of treatment, including those from other services. And then the second one is part of this transition after treatment is assessing the effects of the treatment. Of course, women with advanced cervical cancer, usually they have chemotherapy, concurrent chemoradiation, and they will eventually go to menopause. And we have to explain the side effects of those things. And then the last is the follow-up care plan. It has to be clear to the patient what follow-up she has to be on, no? What tests, what surveillance, what is the surveillance for her, care plans for managing late effects of treatment, especially radiation. The effects don't stop after it's finished. No, some could last even for years. And of course, it is also should serve, follow-up care plan should also serve as a reminder for healthy living in the hope of preventing a recurrence or a new cancer. Okay, so this cancer continuum I got from this book from the U.S. Institute of Medicine and National Research Council. And it's entitled From Cancer Patient to Cancer Survivor, Lost in Transition. No? So Kakat dealt with the first 4 boxes. So I'll be dealing with the last 2. But first, on the pink one, survivorship. So who is actually a cancer survivor? And there are so many definitions, but no exact one. Some would say they are a survivor from the moment of diagnosis and buhay sila. Some would say they cannot be considered a survivor until she completes the initial treatment. In this case of advanced cervical cancer, locally advanced, that is concurrent chemoradiation. Some would say they cannot be considered a survivor unless she lives 5 years beyond diagnosis. Diba marami kayong naririnig, ay pag 5 years na akong walang sakit or buhay, survivor na ako. No? Some would naman put it at some other point after diagnosis or treatment, while some would reject the term survivor and would rather be called fighters. So there's no really exact definition of who is a cancer survivor. It depends on who you are talking to. Is it the doctor? Is it the patient? Or is it the caregiver or the loved ones? Okay, so this slide shows you Mulan's 3 seasons of survival. So Fitzhugh Mulan is actually a doctor. He's a physician who was diagnosed with cancer at the age of 32. He was at the prime of his practice. He has a growing family. And so he divided survival into 3 parts. The first one is acute survival. So that is what Kaka discussed, no, yung diagnostics and therapeutic efforts. And that's acute survival, and it is mainly governed by fear and anxiety. The second one is extended survival. That's when one finished already the treatment and enters into a period of watchful waiting with periodic examinations and additional treatment as necessary. And here, the predominant mode is physical exhaustion. Coming from treatment, of course, there is pagod ang pasyente after going through the treatment. And of course, there's that psychological aspect of the fear of recurrence. And that last part is actually permanent survival, no? Roughly equated with cure, but leaves an indelible ink to the patient na cancer ako and that cancer is with me all the rest of my life. No? And one is ready to resume the full life, magaling na ako, but there are many obstacles, including some would not be accepted for employment because of their previous history of cancer. Some would have issues with getting insurances kasi nga may sakit, nagkaroon sila ng cancer, as plus long-term effects of treatment. No? This may be a very, quite an old journal, 1985, but remains to be true up to this time. So what is survivorship in cervical cancer? No? So why do we need to discuss this? There's an increasing number of women surviving cervical cancer because of the very new treatments. No? So it's important to focus on helping cancer survivors address survivorship issues. And I've listed here some of them, no? So persisting side effects at the end of treatment. So GI dysfunction, mainly from radiation. You have emotional and psychological issues, distress, anxiety, depression, cognitive changes, and of course, fear of cancer recurrence. Altered relations, including that of intimacy, sexual health concerns, very particular, no, for cervical cancer. So it goes beyond the ability for sexual intercourse, but also encompasses intimacy, desire arousal, body image, and satisfaction. And yon practical issues are similar to that of MUla's, no, difficulty with return to work and financial hardships. No, so from the same book, a cancer patient to cancer survivor, the 4 essential components of survivorship care we have to remember includes prevention from recurrence and new cancers, surveillance. If we cannot prevent, then we hope to get the recurrence early. Then we have interventions, no? So long-term side effects have to be addressed with some interventions. And lastly, coordination of care between all providers to ensure the women's needs are met. And of course, this woman, you have to empower her. She has to understand what is happening so that she will know what she will still pursue, what are the desires that she can still, ganun eh, yung the things, she has to balance everything. The fact that she's a cancer survivor, ano pa ba yung pwede kong gawin? Ano pa ba yung kaya ko, gusto ko, these things, no? And so that's for survivorship. So those are the issues you have to discuss with the patient. And that's one good thing. You have to empower that patient. She is a survivor anyway. And then we go now to the second part. When a woman progresses in her advanced cervical cancer, what is next? No? So there are times there is no cure anymore. So we have to deal with the end of life. And this is actually that part of the continuum. And so the care of persons at the end of life, the earlier studies focus mainly on psychosocial and physiological needs. And the primary outcomes were mainly pain control and the quality of life. But now, we have to be more holistic about it. So we talk about spirituality, functional needs, culture, and other dimensions of the human person. So in the same optimal care pathway from endorsed with the Australian government, there are actually 3 main things. This was emphasized by Kaka, multidisciplinary, palliative care. So we refer to a palliative care specialist. If it's not done, we address pain issues and other bodily concerns. Pastoral care or spiritual advice plus counseling. And you can also have home or community-based care. Then if there are researches and clinical trials for advanced cervical cancer and were available and appropriate, the patient can probably be enlisted in those. And lastly, and very important, is the supportive care and the communication with the patient, caregiver, and family. So I would just like to share with you the next few slides is about the study I did a few years back on end-of-life concerns and preferences of Filipino women with advanced and or recurrent gynec cancer in a government tertiary hospital. So that's in PGH. It's not only about cervical cancer, but the rest of the gynec cancers. And the end product of this was actually a questionnaire, Pinay-AKAP, alalahanin at kagustuhan sa ating paglalakbay sa cancer. And it was a long study. It practically took me 2 years to collect data from the qualitative phase, cases, talks with patients, talk with the physician, and of course, the quantitative phase, a survey. And what did we see here? So these are just examples, direct quotes from the patients in the qualitative phase. Gusto ko humaba ang buhay ko para makasama ko pa yung pamilya ko. Gusto ko wala akong pain, takot akong mamatay. Gusto ko mapatawad ako sa mga kasalanan ko. Gusto ko pang magkaanak. Sana makatagpo ako ng mabait na doktor. Sana may pera siya, sana may bed, sana DPP lang, this is PGH. And ayaw nilang maging pasan sa pamilya nila. And these are actually the rest of the ones in red are the ones which were most commonly said by the patients about their doctors, to be compassionate, to be understanding, the loss of job opportunities, pain, finances, forgiveness from the Lord, and being able to decide for oneself. So the functional component. And after doing the study, this actually ended up to be the domains of the study, which better describe the concerns and preferences of the patient. So their fears, achieving peace with their creator and with their loved ones, taking charge and capacity control, achieving aims and fulfilling roles, matters related to wealth, So kay mahirap, kay mayaman, merong ganong mga concerns, physical effects of the disease and its treatment, external dimensions, processing of eventual outcomes, no? So yung ano ba mangyayari sa akin, magpapa-intubate ba ako, etc. Reproductive issues, desires of the sick, health provider issues, I want a doctor who will not leave me, decisions at the end of life, and letting go. So, yeah, so these are just examples of the questions. It's from napaka-importante to the importante. This is the first of the domains, achieving peace, no? So, kapayapaan sa Diyos, etc. down the line. And this one is about decisions at the end of life. Questions about magpapa-intubate ba ako, magpapa-resuscitate, mapaghandaan yung burol, etc. So, and we need to understand our terminally ill cancer patients. So, this questionnaire gave me lots of things to think about. No, so from the patient point of view, perhaps the role of this questionnaire is it's a useful tool for communicating with their loved ones, a concretization of their concerns and preferences, sharing of their feelings, and a way of preparing for the inevitable. And from the point of view of the loved ones, so actually I didn't get back. I mean, when now that I'm using it for my patients and plus some other doctors do, hindi ko naman kinukuha yung questionnaire, but I give it to their loved ones with the consent, of course, of the patient, so that they can be better understood. No, the loved ones can better understand their patients, and of course, from the point of view of also the healthcare provider to guide us with what they like and what are their concerns. So, but we have lots of challenges in the Philippines with regard to end-of-life care. We do not talk openly about death and dying. Even the health staff have difficulty starting the discussion of such. We have little knowledge about advanced directives, and so really there's much room for improvement in end-of-life care. So these are my 2 key messages. So for the women who survive advanced cervical cancer, we need to address their survivorship issues beyond the medical. And for the women to put to the end of life, we need to give them the opportunity to voice out their concerns and preferences so we will know how to address them appropriately. And ayan, going back to my first slide, I hope that the transition from the treatment to that survivorship will be the beginning of a beautiful story for our survivors. And for those who will be put to the end of life, I hope we can affect their journey. Thank you very much.
Thank you very much, Dr. Toral. So 2 opposite outcomes, but both quotes that you gave are very inspiring. Surviving cancer is not the end of a gruesome story. It is the beginning of a beautiful one. And then we cannot change the outcome, but we may improve the journey. Ganda nun namin. The past few minutes we have been a fruitful discussion. Both of your talks certainly help us in understanding the prognosis and management of advanced cervical cancer. And knowing these things are important because cervical cancer is one of the most common types of cancer among the female population. Now, to give some of their insights on today's talk, we're lucky to have 2 reactors. Our first reactor is Miss Michelle Cu-Unjieng, a businesswoman and a mother who turns her passion into a living. Miss Michelle owns several brands like Jam Food and Company, Breakfast Unlimited, Hexagon Lounge, and ABC Jewelry, among others. And while maintaining these growing businesses, she also manages their sweet family of 4. So our next reactor naman will be followed by Fredeswinda G. Samonte, fondly called Mamu by our cancer patients. She is the founder of the Cancer Survivors Organization in the Philippine General Hospital. So Mamu has been in remission for 7 years, and since then, she's been active in helping the community. Aside from this, Mamu also initiated a cancer support group in Valenzuela City called Cancer X. So everyone, let's welcome Ms. Michelle Cu-Unjieng and Ms. Fredeswinda G. Samonte.
Hi everyone, good afternoon. Thank you for having me today. Tora, I just have a question for Dr. Toral. Doktora, when can a patient be called a survivor of cervical cancer? I know you mentioned it earlier, but maybe we can further discuss it so that because people have different views on how to how to define a person who is a cancer or cervical cancer survivor.
Yeah, so you saw my slide, no? Different varied definitions of cancer survivor. But for me, at least from the scientific point of view, I would say a patient is free of cervical cancer after she finishes her treatment, and we have a 3-month observation period, after which we can do our pap smear as a surveillance test, and a repeat imaging, no, like a CT or an MRI or even a PET CT to show that there is no tumor. But there is a new concept now called minimal residual disease, no? So even if there are no, the pap smear is normal or clear, the imaging will not show anything, there might actually be microscopic cancer cells still circulating in the body, but it's not big enough to be detected by the imaging. So that's the difficult thing about really labeling patients as survivor, no? But at least from our point of view, from Gladdy's and from Kaka's point of view, ganon, no? After 3 months at okay ka, okay, very good, you have survived, no? But some would say, ay, gusto ko 5 years.
Thank you, Doktora.
Nakamute si.
Nakamute si Mamu.
Yes. Good afternoon, Doktora.
Hi po. Good afternoon, Mamu.
Happy to see you. Doktora, since you mentioned about end of life, marami na ako nasaksihang mukha ng kahirapan, most especially yung mga nasa stage 3 and 4 na nga po. Since sinasabi po sa makabagong paraan ng mga doktor, yung sinasabi nila, wala na. Hindi ka na magagamot, wala nang treatment sa'yo. Pasyal-pasyal ka na lang. Appropriate po ba sabihin nila yung wala ka ng pag-asa?
Ang masakit 'yun, no? Masakit 'yun, no? So yung wala ng pag-asa. But sometimes the doctors really have to be frank about it, no? Why do we have prangkahin mo siya kasi gusto mo rin siyang matulungan, matransition dun sa end of life na yon. And yun na nga, para ma-address niya yung mga gusto niyang gawin o yung mga kailangan niyang gawin. Ibang pasyente, kung may pera siya para makapagpagamot further, okay yon. Pero may mga pasyente, di ba marami tayong nakikita sa PGH, magsasanla pa sila ng bahay para lang makapagpagamot. Pero sasabihin mo ba yon? Kunyari, mawawala ka, pero yung mga pamilya mo, wawawalan din ng bahay. Ang hirap din, no? So, it really is a personal decision. Maraming ganon, eh. They don't want to burden their families from further expense, etc. So, mahabang usapan ang ganitong wala ng pag-asa. Pwede siyang magkaroon na ibang definition sa bawat ibang tao.
Others po refuse to accept the fact na mamamatay na sila. Kaya yung iba, still fighting. Yan, ang power nila. Tapos, yung iba naman po, since talagang mahihina ang loob, kapag sinabi po yon before the terminal, talagang bumibigay na po. Yun po.
Yeah.
Si Doktora.
Kasama sa trabaho din namin na tulungan sila, no? Na mapaghandaan yun. Lahat naman tayo pupunta doon. Kaya lang maganda ring nakakapaghanda.
Opo. Thank you, Doktora.
Yung mga doctors, no? Mamu, I experienced sa PGH, no? There are some patients who would actually prefer to know. Sila mismo yung nagsasabi, Doktora, ilang buwan na lang ba ako na magtatagal? Kasi gusto nilang maging ready. Iba naman, pag sinabihan namin na 3 months ka na lang, nadi-depress sila, and nagmumuo. So, tapos, mababalitaan na lang natin. Sila yung nauna na. So, I've had patients like that na pag na-depress, nauna. Eh, mga pasyente, wala din sinasabihan. Yung malulungkot, una. Yung masaya, o malakas ang loob, sila yung may iwan. Diba, Mamu? Nakita niyo po si Mamu at this age. Very healthy pa si Mamu. And he actually inspire a lot of our patients. Dito sa Q&A box natin, may mga questions tayo. For Doktora Castro, you've mentioned about treatment for advanced cervical cancer. And ang gamot para sa cervical cancer na advanced ay chemotherapy. Mahal po ba ito?
Depende po sa gamot. May mga iba't iba po tayong gamot na ginagamit for cervical cancer. Merong isa lang, meron ding kombinasyon ng chemotherapy. Meron din yung mga, katulad ng sinabi ko kanina, targeted therapy, yun, medyo talagang mahal. And then the second line treatment, immunotherapy, napakamahal pa sa ngayon. Nakita naman natin yung over the years, no, habang dumadami yung options, bumababa rin yung presyo. So I'm hoping for a time that everything will be available and affordable to our patients. We have government assistance, lalo na sa PGH. Meron tayong DOH funding, meron tayo from Office of the President, we have PhilHealth to assist us with these medications. And meron tayong foundation nila, Mamu. Di ba, Mamu, somehow you help financially, no? Hindi lang emotional support. They also help with the financing of the patient's medical needs. No? So sa ngayon, mahirap pa kasi talagang out of pocket pa. It's not like a universal, hindi katulad sa ibang bansa na pinaprovide solely ng government and the patients don't have to worry about where to get the finances. Pero marami tayong pwedeng paghingan ng tulong about it.
Thank you, Dr. Castro. Mamu, being a survivor of cervical cancer and seeing yung patients from being newly diagnosed to advanced to terminally ill patients, can you share yung mga insights mo tungkol sa mga pasyente natin?
Sa mga nasasaksihan ko nga po, lalo na po yung mga bagong pasyente, talaga pong upset sila, wala po silang pag-asa na gumaling since wala po silang kakayanan na magpagamot. Doon po kami pumapasok para sabing marami po tayong government agencies, katulad na sabi po ni Doktora Castro. Ang dami po government agencies. Number 1 po ang PCSO, kaya doon po namin kinuha ang aming pangalan sa PCSO. Ginagabayan po namin ng mga pasyente, lalo na po yung mga hindi nila alam kung saan pupunta, tapos yung mga gamutan na sinasabi nila na wala naman daw nagsabi sa kanila. Kaya nga po nandoon kami, tinutulungan po namin sila kung paano makahingi ng tulong. Tapos yung mga nasa pain, katulad po namin ngayon ng aming presidente, si Reggie Trilon, nakamonitor po kami sa mga sobrang pain. Most especially pagdating po ng gabi, upset wala po silang masyado silang balisa, hindi makatulog. Kinakausap po namin sila. At the same time, we pray together po. Tapos yung pong mga gamot na leftover ng mga hindi na kailangan ng pasyente since babaguhin, kinukuha po namin yun at ibinibigay po namin sa mga ibang pasyente. And besides doon, nagpupunta pa rin po kami sa mga probinsya para kunin po yung mga gamot na mayapa na. Natatakot po yung iba na gamitin yung gamot na yon dahil baka daw mamatay din sila. But in fact, wala naman sa namin, gagamitin na rin po nila yun. Yun po, nagtutulungan po kami. Ito po yun.
Opo, nagtutulungan ang mga patients.
Kami po mga pasyente nagtutulungan. Wala po kaming pondo talaga, kaya kami lang po, kami mga members, officers, nagbibigayan po kami. Nakakalungkot lang po yung iba, bago namin malaman.
Talaga po, yung mask ko pala. Mask at saka shield ko.
Pero Mamu, gaya ngayon, because of the pandemic, no, nagkaroon ng limitation sa movement ng mga tao. And kita naman natin sa television, most government hospital institutions, lalo na ang Philippine General Hospital, madaming pasyente.
Opo, nakakalungkot po na pansamantala pong isinara ang Cancer Institute dahil nahiram din po kahit paano yung mga doctors natin sa Cancer Institute para mag-assist sa mga COVID patients. At the same time, masyado na po talagang talamak ang COVID, lalo na po yung tinatawag na Delta variant. Kaya yung OPD, yung ER, mga talaga pong hindi na sila mag-accommodate ng mga pasyente. Not unless niyo po yung mga nagkikimo, binibigyan po talaga ng priority ng Cancer Institute. At talagang titignan niyo po, bumaba po yung cancer, cervical cancer, yung rate ng cervical cancer. It's because of the pandemic nga po. Sino po magpapagamot? Saan po sila magpapagamot? Kaya hindi nila kayang pumunta ng PGH. Kaya mababa ang rate natin ng cervical cancer. Nakakatuwa lang po tingnan, pero ang totoo po niyan, hindi po nila kaya, hindi na po sila makapagpagamot. Tinuturo ko pa sa ibang hospital, hindi rin po sila ma-accommodate. Pero meron pong isang hospital na, yung East Avenue, na tinatanggap po sila. Po.
Dr. Castro, so dun sa sinabi ni Mamu, no, kailangan natin sabihin dun sa mga pasyente, hindi naman tuluyan nagsara ang cancer center. Nakita natin sa statistics, tumatanggap pa rin po ng mga cancer patients. Pero, syempre, pinaprioritize po natin kung sino yung mga mas nangangailangan ng gamutan, sino yung mga kailangan maunang makatanggap ng gamutan. So, binabalanse din po natin yung risk at saka ang benefit na makukuha ng ating mga pasyente. So, apart from PGH, Doktora Castro and Doktora Toral, ano po yung maipapayo nyo dun sa mga pasyente natin na kailangan ng gamutan?
I understand talagang takot kahit hindi naman yung mga cancer patients. Marami namang talagang natakot pag sinabi yung PGH, pupunta sa PGH, COVID center nga, di ba? Even my patients, takot, no? So, I want them to know that there's telehealth. So, yung hindi ka agad makakapunta physically can access our doctors sa PGH, pati yung mga gynae-onco fellows natin through telehealth. Kasi pwede yun ang number one step. And makikita doon, ma-evaluate sila kung kailangan nilang pumunta. Kasi kung kailangan nilang pumunta, binibigyan sila ng schedule. Hindi po, I think nagsara lang for a while, nung umpisa, nung March 2020, and then slowly nag-open din. May, I think, fully operational. Hindi na ulit po nagsara ang Cancer Institute. Ito yung isa sa mga services ng PGH na hindi nagsara because nga po cancer ang pinag-uusapan. Yung OPD, minsan po nagsasara, pero ang Cancer Institute never na po sinara after that initial closure. Except sometimes maybe patients are scared to go because nga yung impression that PGH is a COVID center, lahat ng pasyente ton COVID, baka mahawa sila. So there's telehealth. They can have an initial appointment through telehealth. They will be evaluated there and they will be given a schedule to come for face-to-face. Mas inaano na po, mas maayos na lang para hindi kumpol-kumpol, hindi masyadong maraming dumadating all at the same time, para may spacing, yung mga ganun pong bagay. And of course, katulad naman dati, patients pa rin, we will still request our patients to extend more patients, have more patients, kasi talagang maraming pasyente, medyo minsan matagal bago mabigyan ng schedule, pero pinipilit na lahat sila ma-attendan. We also have other institutions. JR is also another institution with training for gynae-onco. That's also one other institution where they can go to kung talagang hindi nila maatim pumunta ng PGH. But services have never closed ever since that initial closure last year.
Thank you, Dr. Castro. So we have another question. Dr. Toral, for our patients who already have advanced cervical cancer at the palliative stage na po, are there any studies regarding natural remedies for these patients?
Natural remedies. I'm not aware of studies talaga, no? Pero kasi many patients would ask, ayun na nga, pwede ba silang, di ba maraming mga treatments, quote-unquote, na under the naturopathies, no? But if you look at our guidelines, lahat tayo standard treatment. Standard treatment yung inaano natin, ating ina-advocate. And of course, if a patient is at the end of life and would ask me, oh, pwede ba ako uminom ng barley at saka kung ano-ano pa, let me quote my favorite palliative care specialist, Dr. Andrew Ang. Sabi niya, kung makakabuti sa pakiramdam mo at hindi makakasakit sa bulsa mo at ang kidney mo at ang liver mo ay hindi bibigay, sige, bakit hindi, no? Kung yun ay ikakaganda ng loob ng pakiramdam mo. Well, for people at the end of.
Pero paano, Doktora, yung mga early, although sa advanced stage tayo? Ma'am, ano yung mga naririnig mo na kadalasan iniinom ng mga pasyente?
Ay nako, pinagbabawal ko po sa kanila yun. Mismong sa DOT po nanggaling yung mga supplement na yan na hindi naman talaga approved ng FDA. Lalo na po yung mga, ayoko na mag-mention ng names, pero meron pong isang case na nag-take po noon, knowing nagagaling siya, when in fact after 3 weeks, nagdi-discharge po siya ng blood, black na blood, mabaho. Kaya sabi ko, hanggat maaari, masakit na sa bulsa, masyado pa ang paniniwala nila, kaya sinasabi ko na lang, kayo, sa sarili nyo kayo naniniwala, when in fact, nandiyan ang Panginoon na talaga siyang magpapagaling sa inyo. Huwag kayo mag-rely sa mga supplement. Hindi naman talaga gastos na malaki po yan. Ako, never po ako nag-take ng supplement ever since 2014. Hindi po ako nag-take kahit na ano. Malunggay lang po ako. Malunggay lang. Yun lang po.
Doktora, I have a question for both doctors. Yeah, I'm sorry. Yeah. How would you know, or what are the signs for early stages of cervical cancer, and what should we watch out for us to consult an oncologist, ma'am?
You take yun. Start mo yan. You answer na lang.
Yeah. I always call cervical cancer a traitor, no? Traidor na sakit, because when it manifests, when a patient develops symptoms, most of the time it's already in the advanced stage. Because usually the early stages of the disease asymptomatic. Madalas po walang nararamdaman. Paminsan, merong spotting na binabaliwala, no? But most of the time, patients are asymptomatic. So we don't wait for symptoms to come. What we always advise our patient is to have a regular checkup, regular gynecologic checkup, and regular cervical cancer screening. Marami pong paraan. Meron yung pinakaalam ata natin yung pap smear. Meron din po yung VIA testing, yung visual inspection with acetic acid. Ngayon po yung mas high-tech at mas pinopromote ngayon is the HPV DNA testing. These are all testing for cervical cancer. We advocate this to be done on a routine basis, a regular basis, to detect cancer at its very early stage, or sana pre-malignant stage, kasi if we detect it at that point, napakadali pong pagalingin. Pag hindi pa cancer, papunta pa lang, napakadali pong gamutin yon para hindi na papunta sa cancer. Or if it is already cancer but still very early stage, it is highly curable. That's what we want women to understand. Do not wait for symptoms, because most of the time, if symptoms are experienced, these cases are already in the advanced stage. Jean?
Toral, I have a question again for you. Yes. After having all the treatments and going through all the chemo and all the possible cure that we think we can go through, and then they survive, what are the key things that one should remember in respect of follow-up with oncologists and home care setup?
Okay. So I think in one of my slides, no, so there's prevention. So you prevent another cancer from occurring. So paano ka magpe-prevent? So advocate for healthy living already. If you are a smoker, stop smoking. So things like those, no? So then the next one is surveillance. Very important. Yan, yung we go for yun yung sinasabi namin sa patients. Pag once you are a cancer patient, your follow-up with your doctor doesn't really stop. It just becomes longer. The interval just becomes longer and longer for as long as you are better, no? And then coordination with the rest of the other doctors if for other types of care, no? And yun, at saka of course, there will be really symptoms that need to be addressed because they are part of the long-term side effects of the treatment. So,
Yes,
dapat sa ganon, kailangan maturuan yung patients about it so that when it comes, kung hindi pa nila nare-recognize, maalala nila na sinabi yan sa kanila ng doctor nila.
Okay. And then any special setup at home, Doktora, if they're recovering or parang
yeah.
more
I think yung mga questions like, kailangan ba sila mag-isolate habang
Yes.
habang nagkikimo? Actually, no, hindi naman kailangan. Hindi naman yan, yung, di ba, yung radioactive iodine for thyroid, don't kailangan. Pero itong radiation natin for cervical cancer, wala namang ganoon. No?
Okay. Thank you, Doktora.
I always tell them, no, kasi akala nila nga nag-emit sila ng bad effects to their family members. I always tell them, actually, baka yung family members mo pa nga ang magdulot ng something sa iyo kasi lumalabas na and pwedeng maghawa sa kanya. But so you just have to reassure them. Also, some precautions like maybe flushing the toilet twice, just like that, and avoiding people who may be sick or may not be feeling well in the house para lang maiwasan na sila yung mahawahan sila ng sakit because medyo mababa ang immune system nila kapag nagagamutan. Otherwise, wala namang special preparations pa in the house.
Hindi, pagbalik sa full life nila, pagbalik nila sa full life yun sana yung gusto natin.
Yeah, na makabalik sila in with konting modifications with
of course.
Living. But we want them to go back to their normal life.
Yung mga cancer patients, Doktora, parang nauna silang mag-practice sa atin ng wearing of face mask.
Oo.
Sila talaga ang prepared for COVID
Oo. Tayo pag nag-opera lang dati, naka-face mask, no?
Yeah.
We have a question from our audience. I understand that there is a vaccine for uterine cancer. Is there a vaccine for uterine cancer?
Yeah.
Doktora Castro?
Yeah. There is a vaccine against cervical cancer. When we say kasi uterine, nakapansin nyo yung naalala nyo yung picture natin kanina, di ba? Pag sinabi natin kasing uterus, it's the entire womb with the upper part and the cervix. Hinihiwalay natin yon. There is a vaccine against cervical cancer, pero wala pong vaccine against upper part na yung body. Cancer there. Pwede kasing sarcoma yon, pwedeng endometrial cancer. Wala pong bakuna for that. But there is a vaccine against cervical cancer. Yung topic po natin ngayon, meron pong bakuna laban doon. Bakit? Paano nagkaroon ng bakuna? Kasi ang cause po ng cervical cancer is a virus. So nakapag-develop po, because of researches, they were able to develop a vaccine against that particular virus. So it protects against women who may have contracted the virus from developing cervical cancer. So it's a preventive vaccine.
Kaya po kaya natin recommend, Doktora, na magpabakuna yung mga kababaihan?
Ang ideal nun is bago magkaroon ng pagtatalik. Kasi yung virus na nagkakos ng cervical cancer is something that can be transmitted by sexual contact. So kung gusto nating preventive, dapat maibigay natin bago pa mag-start ng sexual intercourse ang babae. So ang recommendation natin is 9 years old onwards. Kasi at this time, hindi pa sila nagkakaroon na exposure, hindi pa nagtatalik. So no exposure yet to the virus. So sa kanila magiging effective. Hindi lang ito binibigay sa babae, binibigay din natin siya sa lalaki. Although initially this was made for cervical cancer, na-expand na yung coverage niya for other diseases, other cancer that is caused by the same virus, by the HPV virus. Marami po kasi yun Sa babae, cervical, vaginal, vulvar, meron din against warts, and then sa mga kalalakihan, penile cancer, anal cancer, the warts, and throat cancer. So, kaya pati lalaki, binibigyan din ng bakuna na yon. Also, starting 9 years old onwards.
Okay, so both for boys and girls. Pero Doktora, halimbawa, meron na akong history ng pakikipagtalik. Pwede pa ba?
Ako, I still recommend it. If you look at the FDA approval of these vaccines, 9 years old onwards, walang upper limit sa age. Although, of course, it will be most effective kung wala pang pagtatalik. Kaya in other countries, they would only limit it to 9 to 25 and then catch-up period 25 to 45. But in our country, our FDA approval for that is from 9 years old onwards, no upper limit, meaning that it might still benefit patients even if they have already had sexual intercourse. We're hoping that hindi pa nila na-acquire yung virus, or if ever na-acquire na sila ng virus, isa lang, marami kasing coverage yung vaccines na yan. So they may still be protected from viruses that have not been contracted by the patient.
Gladdy, I would just like to add no. Kasi some people who are listening, they might think na pag vaccinated na ako, I'm fully protected. It doesn't protect you completely, no. There might be some patients na had a previous history of HPV vaccination and still got cervical cancer. Likely, they probably had that virus already growing in there, but never got to be discovered. So that's one. And then yun na nga, it is not 100% effective. Best talaga for the young girls na hindi pa talaga sexually active, no? So that when they meet the virus, when they become sexually active, yun na, may panlaban sila. They have the antibodies because they were vaccinated. And yung YAF study, the young and adult fertility study, based on that, the average age of the sexual debut of Filipino women is actually 18 years old. So, yon, medyo bata, no? So, try to catch that one if possible.
I heard, Doktora Toral, no? Meron din sa schools, kasi yung pamangkin ko is 9 years old. They are already giving out free vaccinations for HPV.
That's the DOH program. The DOH program is actually now school-based siya until, of course, the pandemic came and the students were not going to school, di ba, for almost 2 years already. Kaya nagkaroon ng problem. I don't know what adjustments, baka Kaka might be aware of it. Kung ano yung adjustments na ginagawa ng DOH so that program can still continue.
Right now, I'm not aware of any adjustments as of this point, Ma'am Jean. I think they're focused on vaccination against COVID kasi, no, para makabalik sa school. Tsaka tinatry pa rin maging universal coverage for that vaccine kasi they started it parang mga pilot studies in some communities and in some schools. So maybe, pag nakabalik na sa school, baka yun na ulit magkakaroon na efforts to reach out to all of those children that school age, yung grade level na yun, para maging mataas ang coverage nila. But I'd just like to add more to that. No? So aside from the vaccination, hindi tayo nagbago ng recommendation regarding screening. Yung sinabi ko kaninang pap smear, HPV testing, VIA, despite the advent of vaccination, hindi po natin binago pa yung recommendation for screening. We still advocate that. So it's patong-patong, several layers of protection, being vaccinated at the same time getting screened. Because as Ma'am Jean said, wala namang vaccine na 100% eh. Kahit anong vaccine man yan, walang 100% protection. So you still can improve your layer of protection by having screening regularly as recommended for our women.
For our cervical cancer patients, Doktora, kailangan ba bakunahan yung mga anak nila? Namamana ba yung cervical cancer?
Hindi ito hereditary, hindi ito namamana, pero kailangan bakunahan as many people who are qualified for the vaccine as possible because they can contract the virus, diba, through sexual transmission. So it's not necessarily something that they will inherit, but they might get when they become sexually active. So kailangan po nating i-emphasize na everyone, lahat ng qualified, should be given sana the vaccine for protection.
Thank you po. For Doktora Toral, Doktora, nasabi natin yung mga patients natin with advanced cervical cancer, ang concern nila usually, ayaw nilang maging pabigat.
Yeah.
So, meron ba silang pwedeng puntahan may institutions ba or support groups wherein they could go? Parang yung home for the elderly.
Baka si Mamamu ang mas may alam, ano? Pero actually, yung sa Philippine Cancer Society, meron dong mga doctor-driven programs din sila. Pero kasi yung functionality, yung functional capacity nila, yun yung ano mong tanong, ayaw nilang maging pabigat. So unang-una, kung survivor ka, sana yung mga offices at saka yung mga companies na pwedeng yung mga pwede naman sila magtrabaho kahit they have been previously diagnosed with cancer. Sana hindi sila ma-discriminate, that's one. Tapos yung sabi mga institutions saan sila pwedeng lumapit, maybe si Mamu can give us some things about where they can go, no, kung pabigat, saan sila kukuha ng pera. Tapos na to, assuming, di ba, Gladdy, ang question mo parang survivor na sila. Sana pwede silang bumalik sa na pwede silang makapagtrabaho at kumita, no?
Marami kami, Doktora Toral, na cancer patients na mga nag-o-office po sila. Tinatanggap naman po sila. Wala pong discrimination. Basta as long na hindi po hard work ang bibig.
Yeah.
Mga offices, mga employees po. And besides, Doktora, naalala ko, there are offices kako na nagre-require ng mga HPV vaccine through salary deduction. Yung po ang na-inform nila sa yung mga nag-o-opisina. Through salary deduction, nagpapa-HPV vaccine po sila.
Compassionate ang kanilang mga employers. Mabuti po yan.
Sumusunod sa DOH. Doktora,
another question. Doktora, sorry. Pag po ba sinabing for hospice care or for referral to palliative care, ibig sabihin, mamamatay na ang pasyente?
Hindi actually, no? So the referral to palliative care is not based on the prognosis, but on the need, no? Pwedeng hindi ka pa naman end of life, pero pwede ka naman ma-refer na sa palliative care. Kung may mga issues ka, ang tingin mo, ikaw as the primary doctor, hindi ka capable, you can always refer to the palliative specialist. And of course, sila yung mga kanina nakalimutan ko sabihin, nag-home visits kasi sila. Di ba sabi mo kakamit, nag-telehealth, ganyan kanina, yung walang access to care. This palliative care specialist would can visit you at home. Of course, meron sila for a fee din, no, for a fee. But of course, sana naman yan, they are affordable for many of the patients. So hindi kailangan mamamatay ka bago ka i-refer. It's
so,
based on
for our patients who are watching this this talk, no, pag po di-refer namin kayo sa palliative care, hindi po ibig sabihin wala ng pag-asa. Maaring may nakita lamang po kami sa inyong sitwasyon na kinakailangan ng guidance po mula sa isa pang specialista. Okay? Kasi takot sila, Doktora Toral and Doktora Castro.
Ideally nga sana lahat. Kung hindi lang consideration din yung cost, of course, of the consultation, it will be ideal. Sabi nga natin, di ba, multidisciplinary approach. And these doctors are part of the team.
Yeah.
Kasi maraki yung tulong na mabibigay nila. We may be focused on the medical aspect, but somebody else should take care of the emotional, the psychological, the religious aspect of the disease, not only of the patient but also of the family. That's where hospice comes in. So hindi kailangang mamamatay na bago pa i-refer.
Baka too late nga yun eh. Baka too late, no?
Even spiritual guidance, yes. No? Our priests should be part of the team, I think.
Yes po. The priest or the pastor po,
the pastor, religious guidance
approach. I'd like to acknowledge the presence of Doktora Shasu. Sabi ni Doktora, palliative care starts at the diagnosis of cancer and not at the end of life. Thank you po, Doktora. So, ang daming questions actually, but we are limited with our allotted time. So, I would like to ask our reactors and our speakers, for our patients with advanced cervical cancer, ano po yung maipapayo nyo sa pasyente at saka sa mga family members nila dito sa journey nila na ito. Doktora Castro, let's start with you po.
Those who are already in this situation, wag pong matakot. We need to accept, yes. We allow you to grieve with the diagnosis. I think that kailangan i-allow namin kayong i-internalize and accept it. We will try to help you with the process. But ultimately, we have to rise above it para makalaban na tayo, no? Ang laban hindi palaging ibig sabihin gagaling, pero laban para maging maganda yung quality of life, whatever remaining time we have. Ayoko rin pong isipin nyo na pag sinabing cancer is a death sentence. So, try not to ask ilang buwan na lang, ganon, kasi medyo nega. But focus on paano kaya magiging maganda kung ano man yung remaining life that we have, diba? I think that's it. And we will be here to help you and guide you. We will help each other out, no? So good luck and God bless to all of you.
Thank you, Doktora Castro. Doktora Toral.
Okay, so pag ang pasyente nasa advanced cervical cancer, of course, kung wala ka pang nag-receive na gamot, go for treatment, no? There are countless possibilities. Yun ang sa totoo. And hindi iba-iba ang storya ng bawat babae. Hindi porket hindi maging maganda experience ng isa, magbe-base ka doon na hindi ka na, no? So, and we as the doctors, we try to lay down the pathway for you. And tanungin nyo lang kami para maintindihan nyo, hindi lang ng pasyente, pati yung mga loved ones nyo, at saka yung mga caregivers. No? Kasi that is very important, the understanding, so that the patient will be able to determine for herself what direction she would like to take. In the end, it's actually her who will decide that. And we are just guides to them.
Thank you, Doktora Toral. Mamu?
Yes, sabi nga ni Doktora Castro, ang cancer is a death sentence daw. Hindi po, kaya po wag pong matakot dahil yung C na yan, wala po yan sa big C na nag-guide, bless us, tumutulong at para pagalingin po tayo. Sa mga caregivers po, pakiusap lang po. Maawa po kayo sa pasyente, lalo nyo po silang mahalin. Kasi lagi po kami nakaka-encounter ng mga hinanaing ng mga pasyente na sila nga ay pabigat, pagkain na lang, kinakapos na, idadaan pa sa gamot, ibibigay pa sa gamot niya. Kaya yung pasyente, better na wag na lang po siyang uminom ng gamot kasi nga po, nakakarinig po siya ng hindi magaganda. Kaya mapapalad po yung mga pasyente na mayroon pong maarugang pamilya na nagmamahal at nagmamalasakit. Kaya mahalin po natin ang ating mga pasyente. Mahalin natin ang sarili natin para sa atin, sa pamilya, at syempre sa bayan natin para walang dadaming cervical cancer na patients. Yun lang po. Thank you po.
Thank you, Mamu. Miss Michelle?
Na-log out ba yan?
Na-log
out yata siya.
Okay, so that has been a very fruitful discussion. So again, our sincerest gratitude to our speakers, Dr. Jean Toral and Dr. Carolyn Zalameda-Castro, and our reactors, Dr. Fredeswinda Samonte and Ms. Michelle Cu-Unjieng. Before we end, we, the MU webinar team of the Mu Sigma Phi Medical Society, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, the City of Manila. This event would not also be possible without our co-presenters, in-life heroes, and the Mu Sigma Phi Foundation, our co-sponsor, Merck Sharp and Dome, and our official media partner, Our Awesome Planet. We are also grateful for the unwavering support of the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch with us. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form at this URL provided. Evaluation within 3 days after the forum should be completed. You may also find the links to the evaluation forms at the comment boxes of Facebook Live, YouTube, and chat box of Zoom. So we would also like to invite you to be with us again at the next leg of MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on November 9, Tuesday, at the same time, 12 to 1 p.m., entitled HPV Gone Viral, the Silent Epidemic. So, ang paggapang na epidemya. For those of you who have unanswered questions regarding prevention, you may join us on November 9. We will be having Dr. Angel Bandola and Dr. Butch Manalastas again as our speakers, and this will be moderated by Dr. Maria Rowena Zito Rosario Raimundo. As for our reactor, we'll be having the creator of My Mom Friday blog, Miss Michelle Lim. And likewise, please support and participate in our year-long Women's Health Forum series. Thank you very much and have a good day.
Thank you po. Thank you. Thank you, Doktora. Love you, love you, love you.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Sheroes and the Mu Sigma Phi Foundation, and co-sponsored by Merck Sharp & Doe. And this event is covered by our official media partner, Our Awesome Planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MUwebinars2021 Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at muwebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on November 9, 2021, Tuesday from 12 to 1 p.m., entitled HPV Gone Viral, the Silent Epidemic, or HPV Gone Viral, ang Pagapang na Epidemya, which will give us a general overview on HPV infection, The speakers will be Dr. Angel Bandola and Dr. Butch Manalastas, and to be moderated by Dr. Wen Raimundo. We will also be having Miss Michelle Lim, a blogger, as our reactor.
And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.